Hello, everyone. Welcome to PDO Max web chat. I'm Jaclyn Luongo, and we are talking about glycation today. I feel like this is a topic that isn't talked about a lot, but we see it very often in our practices. And today we have Gio and Rachel here to discuss this. We have some photos, and we're going to talk about how PDO Max products can improve glycation skin. Rachel, welcome. Please introduce yourself to the audience.
Thank you, Jaclyn. Thank you, Gio, for having me. My name is Rachel Pollazi. I am a background as a CRNA. I am located here in South Florida, and I am so enthusiastic about kind of really good skincare, natural looking results. And so I'm excited to talk about this today. I feel like it's a topic that's really kind of, some people, you say the word glycation and clients look at you with this deer in the headlight, like, what are you talking about? So I think this is not just for providers, but for the public as well. A good topic.
Yeah, absolutely. And you're a PDO Max trainer, of course. Welcome. Gio, how are you?
Good. How's everybody doing?
We're
Good.
great. We're great. And Gio, this came up because we started to have a lot of DMs, not only through the LúmEnvy consumer questions that were coming from since we've launched LúmEnvy skincare, they were sending pictures. Is LúmEnvy good for this? And it was a lot of skin that had that the way I describe it is stiffness. So we're going to talk about that, talk about the
Yep.
products that we find are really helpful. But let's start from the beginning. What exactly is glycation in the skin?
So, one of the big reasons I wanted to do this web chat is because it's really interesting when we get the question of when do you use PDO Glow and when do you use LúmEnvy?
Mhm.
The word glycation, like Rachel said, not it amazes me how few people and how even in clinic I'll go in and talk about glycation and they really don't really understand the difference between wrinkles and glycation. So in clinic, the when people ask me when would you use PDO Glow, when would you use LúmEnvy? Well, you really want to figure out is it a wrinkle or is it glycation? Is it both? So wrinkles are because the muscle has weakened, the skin
Mhm.
has weakened, and it leaves pleats in the skin. Glycation, on the other hand, is actual sugar damage.
Mhm.
It's you'll see it with people with diabetes. You'll see it in anybody that, even if they're skinny, if they are high sugar, they have a lot of sugar consumption. You'll start seeing this mottled appearance because the sugar binds to the collagen. And like you said, it makes it stiff, weak,
Mhm.
yellow. The skin looks dull, crepey, less elastic. You fix it, you try to fix it by controlling people's blood sugar. So it's a systemic issue. It's not just a topical issue. Obviously, we can help it topically, but
Mhm.
the discussion really needs to be also about systemic issues.
Mhm.
So wrinkles are mechanical folding, like I said, visible lines. You can fix them with neuromodulators, collagen stimulation, fillers, resurfacing. So microneedling, PDO Glow is great for wrinkles. Does it work a little with glycation? Yes, because they're anti-inflammatory. And what you're looking at when you're looking at glycation is inflammation, right?
Mhm.
So
Mhm.
bottom line, glycation damages the quality of the collagen. Wrinkles are structural. Glycation is the actual quality of the collagen. So we need to bring down the inflammation so that the collagen can rebuild. If you don't
Awesome.
address glycation, the wrinkle won't age well. So they go hand in hand. But there are people that have wrinkles and have zero glycation, right? So
Mhm.
you know that their inflammatory process in their body is being well controlled.
Mhm. And do you feel like obviously pollution, free radicals like sun damage, all
Oh,
of that also adds
smoking,
to that?
oxidative
Mhm.
stress, UV exposure, chronic high blood glucose, insulin resistance. So you're going
Yeah.
to see with everybody being on GLP-1s, that's going to improve this problem in people.
Mhm.
Um,
Mhm.
so when, and it's interesting because it is one of the reasons I developed the line how I did. It's why we have no retinols or anything in our line, believe it or not, because I'm looking to bring down the inflammation, not increase it. And those kind of products actually don't work well on glycation at all. So you really need to change the mindset of what you're using when somebody has really bad glycation.
Mm-hmm. So Rachel, in the from the provider standpoint in clinic treatment, what are some things that you help to prepare the skin for maybe more advanced treatments with glycation? I have some photos that you've shared with me with some success. So talk us through that process when you have a patient that presents with glycation in the skin.
Right. Well, I would say, typically, first of all, we're somewhat talking about, I would say I really don't start to see a strong glycation effect until kind of, I want to say that like late 40s, 50s decades of life, right? Like my
Right.
younger patients, I really am not seeing kind of what I would say is true glycation. So first of all, we're talking about kind of looking at the population that we're seeing it in, right? And that population also, they didn't do skincare. Like skincare is new to them. Like it is a relatively new thing for this population. So we're talking about years of the sun, like we mentioned, the sun damage, the UV exposure, no SPF, smoking, all the things, right? And so I first, when I see it and recognize it in that population, explain to them kind of what it is and what it's been caused from. And we'll do a quick, like, hey, is your diet super sugary? Like maybe we should consider cutting it back. And it's funny because I even have like these women who are, fitness like freaks, they eat no sugar, but they're drinking their bottle of red wine every night. So yeah, I think we don't even realize like, you got to consider that as well, right? And so that's the first thing. Look at your population. And then it's interesting because Gio and I were recently having this conversation, and I give Gio so much credit. Like I feel like she's such a visionary in like the industry because she has the years of experience and she's seen it all, tried it all. And we were talking about heavy lasers. And while the pictures that I'm going to show, I did do kind of what we call a stack, a radio frequency and an erbium. Because traditionally when I see the skin, I think about, God, we got to blow this off, right? Like, how are we going to get in there and attack this and take off years? Because again, this population, they want the one and done, right? They're not used to the mindset that this has to be maintenance. So, but in talking about that, and we're shifting away from, some of the, like fillers and stuff like that. And you're seeing the shift in the industry to maybe more lasers. But Gio was saying, look, I've seen what lasers can do, and chronic long-term lasers may not be the right answer either. So where does that lead us? That leaves us with these products that we're looking to treat the skin on kind of that, people hate to hear the word cellular level, but that's truly what we're trying to do. We're trying to work on the cellular level where the sugar has caused the damage to the skin and make that collagen healthy again. And so something and it's not simple because it's still a medical procedure, but something as simple as microneedling with these products, the results that we're seeing, instead of jumping to, like I said, blowing faces off, right? Using that term. I think that is something that, providers really need to, sometimes we want to overdo things, right? That's my whole point. So I think starting simple and doing several of these sessions back to back, right? And you're going to start to see those results and you're going to start to really work on that glycated skin.
And to your point, Rachel, I don't think lasers are the answer for glycation. Yes, they're the answer for aging. They're the answer for wrinkles, but you're causing that much more inflammation to the tissue. If we're stacking all these things, that doesn't correct the sugar binding to the tissue. So it is two-pronged. Yes, they do have to watch their diet, but we also have to watch the inflammation we're causing. So that's why I do love, the salmon sperm. This is so when you ask what works on skin that has glycogen problems, vitamin C, carnosine, niacinamide, retinoids work to a degree by exfoliating like lasers do. But again, too much of that still causes too much inflammation. And then you got the PDRN that is, believe it or not, one of the few things that helps with that sugar binding.
And that skin repair, it
The
makes so much
regenerative,
sense.
yeah.
Yes. Which is also what makes sense why you don't go straight to peeling or why you don't go straight to a vitamin A, because you're taking from the skin instead of trying to rebuild that collagen and help with that pigmentation as well, or whatever that stiffness is.
So you still need to work on the static wrinkles. So you need that. You need the retinoids, you need the peptides, you need the microneedling. But those aren't the things that work. It's one of the things, as I've been out training, I see people are like, why does their skin still look like this? And even PDO threads, they work on this. How? Because they microvascularize the skin. That's what we're trying to do with PDRN, Exozone, everything that's out there now that's quote unquote called regenerative. But believe it or not, PDRN is probably the best thing for this.
A great point. Absolutely. And also to pull in threads as well when we're doing biostimulation. And we talked about it on a recent web chat as well, about the power of the smooth threads as well. So I have some photos. I think we should talk about just identifying what glycation looks like in the skin, comparing to, just that dry, wrinkled, seasoned skin. What is the difference? And again, we're talking, I'm going to share my screen. We're talking a lot about, the appearance of it, the stiffness of it, and a yellow tint. Like I've definitely seen that from an aesthetic point of view. There's a yellowness to skin that has that glycation to it.
100%. And that's the picture you're looking at, how you identify the difference between wrinkles and glycation. The glycation is that almost, they're not lines. How do you explain it, Rachel?
I would say even underneath the chin in this picture, almost like little pebbles.
Pebbles, yes. That's glycation. Those are not wrinkles. What are wrinkles are what's on the side of her mouth.
Right.
Okay. But the rest above her lip, and this is why fillers don't work on this kind of tissue.
Right.
You will find that you can't fill those lines.
Great point. So we have a photo from microneedling with AfterGlo and LúmEnvy, which is our PDRN. And these results were incredible that we just had to share this. This is, 20 days after product use. That's incredible.
Right. And that's, a classic example, especially here in South Florida, right? I got all the snowbirds who come down and they just want to fry their faces off in the sun, right? And I don't blame them with that, but they want a miracle, right? And we know that this is not a one and done thing. But again, and also, to the point of, we talk about this population, a lot of them, the word snowbird again, like the retirement age, they, are on this, they're usually on a fixed budget. And so again, microneedling, versus cost of some of the laser treatments, we're at a little bit better in their price range. And we're going to get a wonderful result. I mean, look at this, is amazing, right? 20 days after. So I think this is something that providers, maybe it's overlooked or not thought of to be as effective, but these images obviously show us otherwise.
Well, and look at the skin that has the don't look at the wrinkles as much as the skin that has the glycogen problem. Look how well that is. And I think that I can't believe how little we talk about glycogen in aesthetics. I can't think of a conference I've been to that they've even talked about it. Can you, Rachel?
No.
Really?
No. Yeah.
And really understand why it's happening.
Well, and again, to both of the points here is that if you're not addressing glycation, you're not addressing the wrinkles as well as you could. You're not addressing the concern that a patient typically would come to you for if you don't address that first.
Well, you don't get the suppleness if you don't address the glycogen. I mean, bottom line, the glycogen affects the quality of the collagen, and the quality of the collagen is what helps wrinkle support. So they literally go hand in hand.
Absolutely. Rachel, I have your photos to talk us through the treatment plan from your patients.
Sure. This patient is in her mid 60s. And again, she loves the sun. She's a big pickleball player. That's a big hot thing down here right now. And, again, she had done a little treatments over the years, but nothing consistent and really wanted kind of a wow result. So this one I did actually jump to do a radiofrequency microneedling with an erbium resurfacing. But what I do differently is immediately post the treatment, I am stamping in the PDO AfterGlo and the LúmEnvy. And so you guys can see this result. This result was about 6 weeks later. So not only we talk about that dullness of the skin, but also the glycation in the skin. And this was just one treatment.
And
So
you can see the difference in her cheek glycation. I
oh
mean,
yeah,
and if you're going to use and stack lasers, I highly encourage people to follow it up with a PDRN
yes.
LúmEnvy product. And we go back to what's in LúmEnvy, niacinamide. It's got all the things that attack that sugar molecule, the niacinamide, the glutathione, the PDRN, vitamin C. It's all the important things. As I was researching how to make what I want in the skincare, I'm like, there's one thing nobody's addressing, and that's glycation. And I put all the things in that work on glycation. And guess what? We're all, like you said, Rachel, as we get older, we're all going to have some degree of glycation because we're in the sun. Even if we're using our sunscreen, some UVs hitting us, we all eat some amount of sugar. And the older we get, the less we can
Process it.
And believe it or not, I am seeing the younger generation, because our food is so processed, I'm starting to see glycation at a younger age.
Yeah. And Rachel, the pigmentation as well, obviously with the combination of everything, but we talk about it on many webinars and web chats about the power of PDRN with pigmentation and the brightening of this patient's skin. It's incredible.
Right. Well, and like Gio's point about, these lip lines, like there's no fixing this with filler. Like
there's
you can try all you want, but it's going to look terrible. So, I think, again, like this is it's a key to the puzzle that's been missing for a while in this industry and that I really wish more people knew was an option.
Yeah.
Absolutely.
Like I said, I think it blows my mind because I don't think we don't think about it, right? We see people, we look for a plan, but we don't identify the glycation and go after it specifically.
Right.
And I think we need to. I think we need to say, oh, there are people that have no wrinkles but have a ton of glycation.
Right.
They have a nice full face and they have all this pocked skin. And it's like, those aren't wrinkles.
Yeah.
But we address them as wrinkles.
Right.
Yeah. No, great point. And also to echo what you said, Rachel, that the seasoned skin now that we're treating, they didn't have the skincare routines that the younger generation has, which will obviously help the younger generation down the road, but it doesn't help that more seasoned skin that didn't wear sunscreen every day and didn't have a skincare routine with quality ingredients.
Right. And, the younger generation, like starting the microneedling treatments sooner, even if their skin's not showing signs of glycation, you're going to be treating it to help offset and prevent it, delay. So I think that it's still very, a wonderful product for every population age.
And to your point earlier, it's not necessarily just white sugar, it's all sugar. So any carb, any beer, any wine is gonna give you this. We're not talking lollipops and nerds necessarally, right?
It's food with the sugar.
Yeah, it's sugar. It breaks down to sugar. It causes inflammation. Wow, look at that. Look at how amazing her cheeks look.
Right. That's her full face after, but we had the one before so you could zoom in and see around the mouth because that tends to be where, the hardest area to treat. But yeah, this is her full face before and after.
Her cheeks, that is a wow factor.
Yeah. Yeah.
Wow.
And look at the smoothness. That's what we're
Mhm.
aiming for.
Right. That supple looking, healthier skin, right?
Yep.
Yeah,
Yep.
absolutely. Absolutely. And, of course, we have to talk about what home care that's important, what they're, since they weren't necessarily starting off at an age that we would like, what are we using for at home use to just continue to maintain it? And so that when they do come back for treatment, what are some things that you're recommending, like the Glow Between kit, or we can talk a little bit about that, because that's 50% of the client success is what they're doing at home after a treatment like this to maintain it, and sunscreen, of course. So I think with the woman that we showed with the afterglow that was used 20 days later, some of the home care is that LúmEnvy Glow Between kit, where you are slightly glow pinning and stamping in a bit of that PDRN, the B12 with the glow pin, and then also using the PDRN masks with the plant exosomes for maintenance at home. It's important. It all works in synergy together.
100%.
Well, that's, everybody in their Korean glass skin. This is what glass skin is. It's getting rid of glycation.
Yes.
It's not a miracle. It's not anything other than, let's face reality. Over there, they're not consuming the sugar we're consuming here. That's why they have better skin. That's why it's smoother. But that's why these treatments work for this particular problem.
Yeah, great points. Absolutely. Well, thank you so much for sharing your patient stories and your insight, your expertise, Gio. And thank you so much, Rachel, for sharing some of the treatment plans that are out there. I think we could even create this to be more of a topic for a webinar, because I want to hear people's questions and get that going. So this is a good teaser too. Don't you think, Gio? A
100%. Like I said, I think the buzz needs to get out there. I think that people need to understand what they're treating. And no disrespect to anybody, but we're not treating this particular problem on its own, or necessarily looking at it and understanding what they're treating. We go back to, I've got 40 some odd years in skin, and it wasn't until 20 years ago, I'm going to be honest, that I realized the difference between a wrinkle and glycation. And I think that's important as an industry to understand this component. It will change your practice treating this problem.
Absolutely.
Totally agree.
Yeah. Well, thank you for helping to start make more awareness about this, and we'll keep this conversation going in some sort of part two, I'm sure, when it comes to PDO Max products, threads, PDRN,
Rachel,
and Afterglow.
Yes.
Out of curiosity, can you see the difference in ultrasound between healthy skin and skin with glycation?
Well, I would say, that's a good question.
Question, yeah.
That is a good question.
Yeah, just out of curiosity, how does it look?
Great point.
I would love to see healthy skin under your ultrasound and glycation under your ultrasound.
I will capture those images for you. I will say, you can definitely tell, there's sometimes you can get really good images of when skin is really healthy, like you get some really beautiful images. And then when skin quality is not as great, it's a little bit harder. So I would say that we probably will be able to see a difference. I'll have to.
I would love to see a side by side of that.
Yep.
Of those images, something that no one else is showing.
Talked about
no
exactly.
Yep.
Exactly.
So
that's a great point.
I'd like to see it in a clinical setting.
Yeah, it'd be interesting to look at, because we can see kind of the two layers in the dermis, like at least with our mid-range linear probes, you can see the reticulary and papillary dermal layers. So it'd be interesting to look at that in the glycated skin, like you said, versus like some, younger, healthier skin maybe. So I'll work on that for you.
Yeah, that would be great. Thank you.
Very cool. Very cool. All right. Thank you so much, Gio.
Bye,
Thank
guys.
you so much, Rachel. Bye-bye.
All right, no problem. Bye.